Hello, good morning. Welcome to another live session. All right. Welcome, Adeyemi. Oh, welcome, Dr. Cynthia. You're welcome. So I'll bring you up right now so that we can begin this another session.
Okay.
Okay.
Wonderful. Good morning, Dr.
Good
Cynthia.
morning. Thank
How are
you
you
so
doing
much.
today?
I'm fine,
It's
thank
good to
you.
find. Yeah, it's good to have you here.
Thank you.
Okay,
Thank you.
so let's start. So good morning, everyone from everywhere that you'll be watching this video from. I remain Oluwatimileyin Farino from Second Technology. So today we'll be talking about a topic that concerns us. We're talking about hypertension today, and we have one of our doctors on TeleDoc here with us to speak to us and to walk us through the topic. We'll be introducing the topic soon. But before we introduce the topic to everyone, please, if you can hear me from wherever you are, can you just drop a comment that, okay, I can hear you so that I can know that people you are following, are following this session. I would love your comments from everywhere you are, please. I would love your comment. Please just drop something inside this comment section so that we'll know that, okay, that you're following this, our health talk with Dr. Cynthia today, please. Uh, I'm still waiting for your response, so that it will not be like I'm the one that it's me and Dr. Cynthia that you are just talking. Please, I love your comment. I'm waiting.
Okay. I think somebody has commented. Maybe the rest will
Okay.
join as we start.
Dr. Cynthia, you're saying something. What is it? Oh, good. Good. Thank you so much. Thank you so much, Epemiloluwa. Thank you so much. I really appreciate your comments. So, let's start. So, welcome once again. This is TeleDoc, and what we do in TeleDoc is we connect you to a doctor. Uh, we have numbers of specialists. We have cardiologists on TeleDoc. We have pediatricians. We have GP that you can book consultations with on TeleDoc app. This is just to bridge uh, healthcare gap that exists. In case you're not able to go to a physical office, you can just consult with a doctor right from the comfort of your home, and to make it easier, from anywhere you are in the world. So today, like I said earlier, we'll be talking about a topic that concerns all of us and what we should know about. Today we're talking about hypertension, and I have my special guest, like I said earlier also, she's Dr. TeleDoc, and now I'll be allowing her to just introduce herself, walk us through her journey uh, in as a doctor, so that we can be familiar with her. Over to you, doctor.
Okay, thank you so much for this wonderful introduction. All right, can you hear me?
Yeah, I can hear you. Perfect.
All right. Okay, well, I'm Dr. Cynthia Obiefule Eruba, a general practitioner and a telehealth doctor with TeleDoc app. Today we're going to speak about hypertension. I'm very sure that name does not, it rings a bell. It's a very, very common thing that happens in our environment. Hypertension, simply put, is just increase in blood pressure, or when the pressure in the blood vessels is very high. Um, I'm sure maybe most of us here, our siblings, our family, our friends, or we know somebody who has had hypertension. Um, Epidemiology, like about 27% of Africans have hypertension, and 36% of adults are not even aware that they have hypertension. So the hypertension is when there is increase in blood pressure greater than or equal to 120/80. 120/80, what you mean is systolic over diastolic. Systolic is the pressure generated when the heart contracts. Diastolic is when the heart relaxes. Okay? So then we have these factors that predispose you to hypertension. These risk factors include alcohol, smoking, obesity, sedentary lifestyle, even pregnancy sometimes. Yes, the predisposed to what we call gestational hypertension. Yes. So we have these risk factors I just mentioned now. They are the non-modifiable risk factors. They are the modifiable risk factors. I'm sorry. The non-modifiable risk factors are genes, right? If you have a relative who has had hypertension, you will actually be predisposed to having hypertension. We also have environmental factors. We have age. As you increase in age, yes, it's important to also check with your health providers for your blood pressure, right? And also, we also have gender. Males are predisposed to hypertension than females. And postmenopausal women. The reason postmenopausal is that before, normally women are protected by the estrogen. So in menopause, estrogen level drops. So that's why postmenopausal women are predisposed to hypertension. Now, we're going to talk about the types of hypertension we know. We have
Okay.
primary, we have secondary. Now, primary is also called essential hypertension, basically because the cause is unknown and other causes could be genetic. Okay, so
Okay.
secondary hypertension is caused by the renal. When I say renal, I mean the kidneys. Okay, renal diseases. It could be endocrine diseases. It could be drugs like oral contraceptive pills. Okay, anything, pain medication. Some could predispose you to hypertension. Yes. And then we have symptoms of
So, that's what I want to say. So now,
yes, we have
we talk about
symptoms of hypertension. Sometimes these
Okay.
symptoms can be very vague because, like I said earlier, if you can remember, some people don't even know they have hypertension. You have
All right.
coincidental findings. They just come to the hospital and notice that their BP is high. Okay. So symptoms of hypertension, other symptoms are headache, blurry vision, chest pain, confusion, nausea, and also, like I said, the symptoms could be very vague. Okay, but these symptoms, when you have these symptoms, please, you could go to the hospital and check your blood pressure. Okay. Then we have complications of this hypertension we're talking about. Hypertension affects a lot of organs in the body. Okay, starting from the head, it could cause stroke, what we call CVA. The eyes could cause what we call retinopathy. The heart to cause myocardial infarction. The arteries, it will narrow it to cause atherosclerosis. Okay, so we have treatment for hypertension. The good news
So,
about hypertension treatment
doctor,
is yes,
doctor, I,
yes,
I I know that you're trying to walk us through hypertension, but I don't want this, as it is flowing, to pouring onto us like that. So let's just take it a little bit so that we can really understand the hypertension. So let me just take it this way. Uh,
okay,
um, we are talking about hypertension. We've talked about the symptoms, what can cause hypertension. We talk about genetics. That some people, from their family history and the likes. So I want to
yes,
ask something, but we don't mention. We talk about age. So I want to talk about that age part now. So now,
yeah.
can we link, can a young person, like let's say, some people are saying from age 20, they have hypertension. So what can cause that kind of pain like that?
It's 20, so that's in the young. Most time we call it juvenile hypertension. So at that
Okay.
point, it's mostly due to genetics. It's what we call primary hypertension. I said that earlier. So it's the cause. It could be either for primary hypertension, it could either be unknown or it could be due to genetics. So for somebody who is 20 and having hypertension, it's mostly genetics. Okay. Also, it could be unknown. So we call that primary hypertension. Yes.
Okay now. So now going to we're still on the age factor, and we're still talking about what can cause hypertension. We have this popular belief that a person that is thinking too much, like if you are thinking too much, like they would, if you would tell a person that okay, my BP is high, the first thing they will tell you is that what are you thinking? So can we link thinking too much to? I'm just talking about to just demystify maybe the myth of hypertension. Can we link thinking too much to hypertension?
Yes, it's called emotional stress. Stress is a contributory risk factor for hypertension. I didn't mention that earlier, but yes, stress is an emotional stress is a risk factor for hypertension. Okay. Yeah, so it could contribute to hypertension.
Oh,
Yes.
okay. So now you're talking about. I think before I cut you short, I think you're talking about.
Amongst other risk factors I earlier mentioned, anyway. I can barely hear you. You said? Are you there? Yes, I'm with you. I couldn't hear you at the point again. I couldn't hear you at the point again.
back up now. I think it's the network or something. So, Dr. Cynthia, are you with me?
Okay, can you hear me now, please?
Yes, we can hear you. We can hear you. I think it's the network. I think it's the network. Uh, yes,
Can you hear me now?
it
Okay.
is better. I think, yeah. Yes. So, please continue.
You were talking about risk factors.
Yes, yes. I think that's where we are. Hello.
Okay, hello. Hello. I can hear you.
I'm with you. I can hear you, Dr. Cynthia. I can hear you.
Okay, you asked the question, please. What was that? I didn't get that.
We are on the risk factor.
For hypertension. Yeah. Okay, like I said earlier, you asked, I think, if I can hear you clearly, the last you asked was about somebody thinking too much, and I linked it to emotional stress, which actually impose a risk factor for hypertension. I mentioned other risk factors,
Yes.
which I can actually take back, which I can actually recap, which are obesity, sedentary lifestyle, alcohol, smoking. Okay. Even somebody who has diabetes mellitus, DM, it's actually a risk factor for hypertension too, right? So that's it. Okay. I'm going to go to treatment of hypertension. Um, Hypertension treatment is
Cynthia, please,
basically. Is that?
we can't see you. We can't see you. I think you need to put on your camera or something.
It's on. It's on. Can
It's
you see
on.
me now? Yeah, the
No.
camera is on.
Uh, uh,
Can you see me now?
okay, now. You know what? Let me try to bring you back up. Or let me try and check
Okay.
something. Try. Please, can you exit and join back again? Okay. So, now.
Okay, can you
And
see me now?
yes, yes, I can see you. So,
Oh, thank you.
we've been having Dr. Cynthia since 10 a.m. today, and she has been talking to us about hypertension. She's a doctor on TeleDoc app, and if you've been enjoying our conversation since, you can book her on the TeleDoc app. All you just need to do is just go on our profile. You see the link there, the first link there. Just click it. You see the doctor of the week. Click that. It will take you right directly to our profile. Or you can just download TeleDoc app, or if you have TeleDoc app, just open your TeleDoc app. On the search icon, just press Cynthia Obiefule there, and you see you can book a available time slot. She's available. Just book her available time slot, and you can go to that right away. So, Dr. Cynthia, you're welcome. Please continue.
Thank you. Thank you.
Okay, so
All right. So we're talking about hypertension, and
okay,
basically I'll just quickly do a recap of what I've said before I go to the treatment. Hypertension is just an increase
Okay.
in your blood pressure, and a lot of people are not even aware that they are hypertensive. And it's basically divided into primary and secondary. Primary is also called essential hypertension, and the cause could be unknown, and other causes could be mostly due to genetics. Secondary hypertension could be due to underlying disease like renal disease, endocrine disease, pill and drugs taken. Okay, we have risk factors for hypertension, which could be stress, obesity, sedentary lifestyle, alcohol, smoking. Okay, and remember, these risk factors I just mentioned now are the modifiable ones. Then we have the non-modifiable like age, gender, right? And then we have genes. So we have symptoms of this hypertension, which could be headache, they could be vague generally. Sometimes you're not even aware that you come to the hospital and maybe coincidentally you find out that you have hypertension. So other symptoms could be severe headache, blurry vision, chest pain, nausea, confusion, and loss of use. So we have where I am now is treatment of hypertension, which could be into two. We have lifestyle changes and then the pharmacological treatment. Lifestyle changes are sometimes when your blood pressure is still less than or equal to 40/90. Sometimes the doctor puts you on counsels you on lifestyle change. Sometimes, yes, and then gives you regular appointments. Okay, before the doctor starts giving you drugs. No doctor starts giving you drugs immediately for the first time, except it depends, except in cases of very, very severe hypertension, except in those cases. So for lifestyle changes, we have reduction of weight, we have quit smoking, quit alcohol, okay. We also have what we call DASH approach, a dietary approach to stopping hypertension, where you reduce red meat, okay, and saturated fat. Eat mostly white meat, fish, okay, and then reduce stress. Okay. So pharmacological drugs, that's for your doctor. Most times they start you on one medication, the calcium channel blocker for blacks, and then it's time you come for regular appointment, depends on the doctor and what he sees. All right, so that's when they recommend medications for you. Okay, so basically for exercise, remember exercise is also part of the lifestyle modification. WHO normally recommend 150 minutes of moderate intensity exercise per week or 75 minutes of vigorous exercise per week. So every single workout 2 to 3 times a week, you could keep yourself in check, okay, and regularly weight reduction for those who are obese or overweight. Um, Basically, I think that's about hypertension. If there's any question to ask or any contributions to be made, and once again, thank you, TeleDoc app, for this wonderful opportunity to be a guest on the show.
Thank you so much, Dr. Cynthia. And if you are viewing us from anywhere, please you can drop a comment for Dr. Cynthia. If you have any question, just drop the question in the comment section. We'll take it up and she will reply everyone. So now I want to ask something. For those that did not know um, the normal reading for hypertension, if somebody is hypertensive, please, can you clearly state, okay, from, I know you mentioned it earlier, please, I just want so that everybody can be aware that, okay, so if I read this, I should be scared, or, I should be, this area is the area that I need to be concerned.
Okay, yeah. So the optimal blood pressure is 120, less than or equal to 120 over 80. 120 is the systolic, 80 is the diastolic. So we have what we call pre-hypertension. Pre-hypertension is between 120 to 129. Systolic over 18. That's pre-hypertension. Then we have stage 1, 130. So I think if your blood pressure is greater than 130 over 80, I think you should check with your doctor. Okay, most times the doctor will
And
actually. Okay, you wanted to say something.
yeah, I'm saying that how often we should go for checkup, to reach check our blood pressure.
Well, it depends. Most times, if you have, you must not necessarily come to the hospital per se. There are pharmacies now that have blood pressure machines. Okay, so you could just go there, maybe weekly, maybe monthly, depending on your schedule. But it's something that should be done at least a month. You should go and check what your blood pressure looks like. Yeah, at least every month you should go and check what your blood pressure is, or every 2 weeks you should go and check what your blood pressure is. It's very important because the silent killer disease.
Okay, now. So, and you mentioned something earlier also about people that are prone to be hypertensive.
Yeah.
I know you mentioned some lifestyle changes that can. So, but what is the specific thing that is peculiar to them that they can do to mitigate the risk of them of being hypertensive
Okay,
or to manage
yes,
hypertension?
because I just talked about lifestyle changes in the treatment. I remember saying that the first thing the doctor does is to counsel you on lifestyle changes. Sometimes even when your lifestyle is modified, sometimes there may be no need for the medication because the doctor will definitely give you an appointment to come back and recheck. Okay. So what I talked about, those things that you need to do is to stop smoking, stop alcohol, okay, reduce stress and reduce your weight. And then diet, of course, eat healthy. Then reduce salt intake in the diet. Salt, yes, reduce it. So these are the things that you, as even normal, even if you have a normal blood pressure, I think that you could do to keep yourself in check.
Okay. So now let's talk about people that are hypertensive.
Okay.
So is there? I know you mentioned that. Okay, are there medications once you take it? Because me, I don't really know much about hypertension. That once you take it, some people claim that, or is being advertised that once you take this particular drug, hypertension is gone.
Wow.
Is
Okay.
it is it true or something? So or
No.
a person that's hypertensive
Mm.
can it be controlled with medication or drug or something?
Hypertension can be controlled with medications, yes. Because if you remember in my presentation, I talked about two different approaches to the treatment. I talked about the lifestyle medication and the pharmacologic part. The lifestyle medication is the first part we do. Then the pharmacologic part is the use of drugs, and it's the doctor who recommends it for you. Because there are different classes of drugs of hypertension depending on what your doctor is saying, okay, that they recommend for you. So it's strictly by your doctor. It's not by what is being advertised that you must when you take this, because at the end of the day you are imposing those things you take which are not verified, or you're imposing harm on your own kidneys, which is another complication of hypertension on its own if you don't know. So it should be strictly by your doctor.
Okay, so thank you so much for that answer. And from my own part, let me ask this a final question.
Yes.
Let's say you were to give an advice to a person that has family history of being
Yeah.
hypertensive, or a person that is hypertensive and want to give them an advice on how they can manage their life. What will you say to that person that is watching us right now?
Okay, so if you have a family history of hypertension, we best thing you can do is actually to go for regular checkups because you already know you're predisposed. You're already a risk factor for hypertension. So monthly checkups is for your blood pressure. You know? Then if you're already hypertensive, please just adhere to your medication so that it doesn't get worse. Whatever the doctor gives you, adhere to it. Come back for regular checkups and appointments as scheduled by the doctor. Yeah, so that's basically it.
Thank you so much. We have a
Yeah.
question here
Okay.
from Dr. Coley.
Okay.
The question says, Dr. Cynthia, I have a question for you. In a case when someone's BP is extremely high and maybe bringing in a case when someone's BP is extremely high and maybe bringing the person to the hospital and the distance is much, can you recommend an emergency drug for a non-hypertensive patient?
Yes, they are hypertensive. It depends on what the BP looks like. If the overall what we call severe hypertension and it's greater than 180 over 120, that's severe hypertension. There are drugs that can be given as emergency drugs. When you give those drugs before, if before the patient gets to the hospital, yes, there are some things like that. But you just give it to one, it's just a start dose. Yes.
Like the person, I think the person is asking for, can you recommend or something?
No, I cannot recommend. I cannot recommend now. I have to. The person has to be a patient, right? And then,
Okay.
yes, the person has to be a patient. Yeah.
Okay. So if you need um, doctor to recommend drug or medicine for you, you can just book Dr. Cynthia on TeleDoc. Who will do that. She'll put that in a report for you, and you can go to your pharmacy to buy the medication. So
Yeah.
it's a wonderful time with Dr. Cynthia today. Thank you for coming to our live session. Really appreciate
Okay.
you. God bless you. Thank you for honoring us. And hope that when we call you again next time, you will answer us
Okay.
again. Thank you so much. And
Thank
to
you.
everybody that you're viewing us from anywhere, some people will be watching us later today on YouTube. This is TeleDoc app, and we have Dr. Cynthia and Saints talking about hypertension, how we can avoid hypertension. Dr. Cynthia talk about some things we can just go over it. Like you need to change your lifestyle, avoid smoking. You mentioned about your diet, red meat, avoid red meat, and the like. So thank you, Dr. Cynthia. Till we begin next week.
All
This is
right.
Oluwatomi again. All
Thank
right, bye
you.
bye. Take care.
Bye.
Yeah.